Hello and welcome to the Environmental Health Australia 2025 World Environmental Health Day live chat. My name is Melissa Byrne and I'm the National President of EHA. Firstly, I'd like to acknowledge the Original custodians on the various lands on which we're meeting today and their continuing connection to land, sea and community, and we pay our respects to them and their cultures and to elders both past and present. I'd like to extend a warm welcome to everyone who's joined us today, not only in Australia, but across the globe as we celebrate World Environmental Health Day. I'd also like to welcome our guest speakers, Tanya Morrison, National President of the New Zealand Institute of Environmental Health, Kelsie Dale, National President-elect of the Canadian Institute of Public Health Inspectors, Doug Farquhar, Director of Government Affairs from the National Environmental Health Association in the USA, and John Innis, Air Specialist from the Environment Protection Authority in Tasmania, Australia. World Environmental Health Day is a day to celebrate our amazing profession and the public health professionals who work where health protection begins. Long before a patient sees a doctor, before a virus becomes an outbreak, or a hazard becomes a headline, you're already there, identifying risks, enforcing standards, educating our communities, and protecting the public. Environmental health professionals are the first line of defence in our community's health protection, having a profound impact on human health and also positive economic benefits to your communities, the reduction of illness, which impacts preserved productivity and cost to health services. The theme for World Environmental Health Day this year is Clean Air, Healthy People. This year's theme underscores the urgent need to address air pollution, a major environmental risk that contributes to millions of premature deaths globally each year, resulting in a global economic loss of an estimated $8.1 trillion annually. So that's 12 zeros and a staggering figure to impact our communities across the globe. Fortunately, environmental health professionals are uniquely positioned to lead the change for improved air quality. Whether working in public health, environmental protection, education, or community planning, your expertise can make a lasting impact and protect people from hazards in their environment. We will now begin our live chat today with Kelsie Dale. Kelsie is a distinguished public health professional and environmental health specialist with extensive experience in environmental public health, food safety, climate change, and regulatory policy. She has been a dedicated member of the Canadian Institute of Public Health Inspectors since 2007 and currently serves as their National President-elect. Ms. Dale has held multiple leadership positions at both the national and branch levels, contributing significantly to the advancement of the profession, and she is also the current Secretary for the International Federation of Environmental Health Americas Group. I'd like to welcome Kelsie today. Thank you.
Thank you very much. Good morning and afternoon and evening, everybody. I'm happy to be able to be here today and to kick this off. So thanks for the great introduction. We can move on to the next slide. Before I get into it, I would also like to acknowledge the land on which I live and work, which is Treaty 4 territory, home of the NEHA, Anishinaabeg, Dakota, Lakota, Nakota, and homeland of the Métis Nation in Canada. I am grateful to be able to live and work here, and on the screen right now I've also shared the Canada-wide land acknowledgement that we have for CIPHI. As an organization and personally, I am committed to working in the spirit of truth and reconciliation and making a better future for all and protecting the environment. So excited to be here today to talk about air quality. So here's a quick slide because this was international, just for those who, it's been a little while since you've taken geography. This is Canada and it has over 36 million people and just over 82% of us live in urban areas. So there's a lot of land and a lot of urban pockets and a lot of it is rural, and Canadian health inspectors and environmental public health professionals work in every part of the country. Next. So quickly, just on Canadian public health inspectors, this is an ad here that we did a couple of years ago to highlight how we make a difference. And we make a difference with wildfires, particularly related to air quality, which is why I chose to share this ad today. If you are interested in learning more, our website is on the screen there, and we do represent environmental public health professionals across Canada and certify them, provide continuing professional development hours, all towards a goal of protecting the health of all Canadians. Next. So across Canada, environmental health professionals work for a lot of different employers and work in a lot of different areas. Some of the bigger ones here on screen: food safety, drinking water, recreational water, which includes pools and beaches, safe built environments, air quality, and tobacco and vaping control. CIPHI members and environmental public health professionals are highly trained to protect the health of Canadians and focus on these areas to try to make them better and ensure that regulatory measures are in place. Next. So air quality today, whoops, we're going to focus on in the spirit of happy World Environmental Health Day for everybody. This is just one quick note to welcome international members before I move on. We definitely welcome international members, and if you'd like to join CIPHI or find out more and then be connected to this and other great learning opportunities that are shared, please do so. This was another picture from the same ad for World Environmental Health Day last year, and this is in my hometown, and we bring goats in and they eat the weeds, so pesticides don't run off into water. So not the topic this year with respect to air, but definitely we try to tie in the environmental health in our advocacy campaigns. Next. So now I'm going to get into the focus of this year's World Environmental Health Day, which is clean air, healthy people. This is a photo of the biggest city in Canada, Toronto, Ontario, covered in some air pollution issues. Next. So air quality in Canada, just over time, this is pretty tiny, but it was just to show the trends of air emissions across Canada and that we've been pretty successful in reducing some types of air emissions over the course of the last several decades and some not so much. Next. Here comes up. So just some recent statistics that were most recent of publishing date, I guess. So air pollution in Canada contributes to 17,400 premature deaths, 3.6 million asthma symptom days, and 39 million acute respiratory symptom days. It also costs quite a bit of money. It costs about $146 billion a year to healthcare costs in the time period that was studied in that 2021 report, and $9.5 billion a year in traffic-related air pollution healthcare costs. So we're pretty spread out. We tend to drive a lot. It creates a lot more traffic pollution, which does have cost to our public healthcare system and to people's health in general. And there's more information there on that report at the bottom. No, it's fine. Move on to the next one. I just wanted to highlight, though, we recognize how important air quality is, and these are some initiatives that have been taken across the country by the federal government or related departments. We do have an air quality health index, so you can look that up along with your weather report wherever you are, and it kind of gives you the air quality health risk. So not just the air quality risk on its own, but related to health as well. There's a lot of inventories of different air pollution emissions from across Canada, as well as the Canadian Ambient Air Quality Standards, which look at PM 2.5, ozone, SO2, and NO2. And then in the box on the right, there's just some additional initiatives. Clean Air Day has been around. It's the second Wednesday in June since 1999 to bring awareness to clean air issue. At the bottom, there's a podcast all about air quality that's actually fairly interesting that was put out by Health Canada. Next. So first, I just want to touch on ambient air quality, what in Canada affects our ambient air quality. So increasingly wildfires, we do have a lot of aeroallergens, a lot of agriculture, a lot of other plants producing a lot of pollen and other aeroallergens, transportation, like I spoke to, industrial processes, industry, and agriculture itself. And those are the parameters that we look for on the bottom left. And then this is just a diagram that I borrowed from Health Canada to highlight, I guess, the effects of reduced air quality. It has effects in a lot of ways, and some obvious and direct to health, and some longer term and not as obvious. Next. So I want to put a quick example of ambient air quality issues that we have in Canada. So wildfire smoke and the public health response. Wildfire smoke causes significant health impacts across Canada, and we are seeing more and more years with longer, heavier days of wildfire smoke throughout the summer, but it isn't a consistent consistent air pollutant, and it isn't always coming from the same spot and the same source, and the quality of the smoke differs. So there's a lot more work being done in this area for how to protect the public. Next. Indoor air quality is another significant issue or area of concern, area to focus on for environmental public health professionals in Canada. Canadians spend about 90% of their time indoors. It's cold here for a lot of the year. This is a picture of a Zamboni, which is an ice resurfacing machine that's used in our arenas. And this one in particular is a tractor. And so combustion engine is kicking out quite a bit of exhaust, which if not properly ventilated can cause issue and does cause issue in our ice arenas. There's also other sources of indoor air pollution, of course, smoking, attached garages with other transportation vehicles, cooking, issues related to moisture and mold, and other volatile organic compounds. So public health inspectors are involved across the country in varying ways in these areas. Next. My quick example here was radon. Radon is breakdown of uranium and throughout the Canadian Shield and in other parts of Canada, this is a very common sort of indoor air pollutant in people's basements. And so Health Canada and others have taken steps to measure radon in certain areas, put in radon mitigation systems, put requirements in building codes, requirements in realtor sales, and in other ways to try to protect the health of the public in these houses and mitigate radon exposure. Next. So that's just showing how radon gas gets into houses. Yep. Next is fine. So I just wanted to highlight on this slide environmental public health challenges and opportunities. So with climate change, we are facing increased air quality threats, wildfire smoke, like I mentioned, but also pollen infiltration, changes in our agriculture, and changes in other ambient air quality pollutants. We need more indoor air regulations likely across the country and strategies for implementation. We do spend a lot of our time indoors. If we can get the regulated and get the air quality indoors safer, it will result in a safer population. Real-time monitoring and community science are some options we could look at for increasing the data and increasing measurements towards reducing air quality or air pollution exposures. So public health education is important. Environmental public health professionals are very involved in that. And using a multidisciplinary approach, there's lots of other professionals that we can work with together to make sure that air quality is the best it can be in Canada. And one organization I wanted to mention was the National Collaborating Center for Environmental Health, as they do a lot of research and put together a lot of documents that can guide environmental public health professionals in dealing with issues like air quality. And they're rooted in science and not specific to Canadian regulations. So anybody could access them and probably find very useful information there if you want to look them up. Next. Okay. So that was it for me. I just wanted to put in another one of our advocacy, CIPHI advocacy ads here about supporting the health of all Canadians. Showing a little picture of the beautiful country here. The air quality there is good, probably looks good. So we just all work together, and environmental public health definitely plays a key role in advancing air quality improvement in Canada. That's it.
Lovely. Thank you so much for your presentation, Kelsie. We'll just open up for some questions for anyone that's watching our live stream. If they have any questions, just pop them in the comments box. I have a question. Do you find all levels of government in Canada contribute to air quality, or is it mainly the initiatives from the federal government, or do you find a lot of local level organisations are trying to make improvements from the bottom up?
Yeah, that's a good question. I would say it varies quite a bit. So we've got 10 provinces and 3 territories, each with their own unique regulations, and some do have more specific regulations and stronger programs for tackling air quality, both indoor and ambient, and some don't. And then outside of that, there are some areas in the country that are more overtly affected by air quality issues, and then they have made advancements with air quality resources and strategies. So we do share those when we can, which is great. But yeah, there's some involvement at all levels, but it's not an equal level of involvement at all levels.
Thank you for answering that. All right, we have another question. What are the biggest air quality challenges Canada is facing right now, and how do they impact public health?
That's a good question. We're a really big country, so it's probably hard to pin it down to one. In some of the heavier industrial areas, they may still be facing greater air quality challenges related to that. I would say the one that's increasing more that we haven't seen as much in the past is ambient air quality related to wildfire smoke. And I just finished our National Environmental Health Association conference and had an excellent keynote speaker who was focusing on how do we reduce exposure indoors. So how do we make sure that smoke doesn't come inside, because the impacts to public health are quite significant, and the composition of the smoke and the health outcomes of that can also be significant. So there's work being done in that area to improve the health of the public or protect the health of the public in those spaces that you wouldn't typically think you would see wildfire smoke potentially.
Lovely. Thank you. All right, thank you so much for your time today, Kelsie. I appreciate it's quite late where you are, and thank you very much for joining us in our World Environmental Health Chat Day. Next up, I'd like to welcome Doug Farquhar. Doug is an attorney with 30 years experience working with policymakers on environmental health issues, primarily working with state legislators. He has testified 60 times before legislative committees in 36 states in America, in addition to consulting with state agency staff in every state on enlightening state policymakers. In April 2020, he began as the Director of Government Affairs for NEHA. Prior to NEHA, Doug directed the Environmental Health Program for the National Conference of State Legislators. Doug is also an adjunct professor at the DU Graduate School in Environmental Policy and Management and affiliate professor of the University of Washington School of Public Health. Welcome, Doug.
Thank you very much. I appreciate it. The first slide here, you're going to see a reference to Godzilla versus the smog monster. I'm sure not every one of you are familiar with this story, but Godzilla has taken on several issues, including smog. And he defeated the smog monster back in the 70s, but he didn't get the job done because we still have issues out there. I'm talking to you from Denver, Colorado. We still have 7 hours to go until World Environmental Health Day, but we are going to celebrate it robustly when it comes around at midnight tonight. Next slide, please. To kind of give you an overview of where environmental health is in the United States, this is our survey of what environmental health agencies do. This is not what we want them to do. This is what they've come back to us and said that they do. And it's very familiar, very mirrors a lot of what Kelsie said. Food safety, water, swimming pools, rec water, vector control, body art, on-site wastewater. These are all issues, but on our secondary issues, the ones that people said, well, this is important, but they aren't one of our core functions, is air quality. That's because in local environmental health in the United States, they generally don't deal with air. This is something that we see come down. Policies are made at the federal level. It is really up to the states through state implementation plans to meet these standards, which means we get really caught up in the politics at Washington, D.C., to say what we should or should not do. When it comes to these other issues, what's so critical here is that these are not directed by Washington, D.C. These are all directed by the local community. Every community wants to have fresh food, fresh water. They want to make sure their swimming pools are solid. They want to make sure they have vector in control. All these things are funded, supported, and built up by the locals. This is coming from the bottom up. Air quality really comes from the top down. Now, the exception to that is very much indoor air quality. In the United States, we do not have a national indoor air quality standard. We have building codes which set up standards for buildings, the air in building. We have a language out there on what you should do if you have volatile organic compounds, if you have radon, if you have mold, if you have a host of things that you find inside the building, but you have no law that says you have to meet these standards. And very much so, you don't have to meet them. And it is very much an unfunded, unregulated area that we are combating all the time. But I think that's going to change. Next slide, please. When you look at the environmental health profession in the US and in the world, it's very unrecognized. It's very it is not appreciated. The WHO attributes 24% of the global disease burden and 23% of deaths to environmental factors. In the United States, environmental health is the second largest public health workforce, second only to nurses. Environmental health, meaning water, wastewater, food safety, and shelter, those are the most ubiquitous programs you find in public health among local public health agencies. Everybody does this, even in the most remote, the most rural, the most frontier areas. They're going to be doing water, wastewater, and food safety. They have to do that. They may not be doing chronic diseases. They're not going to be looking at climate change. They're not going to be looking at a host of diseases that occur out there, but they're going to do environmental health. That's absolutely necessary. And it is not funded by the federal level. Environmental health is 93% funded by state and local fees and taxes. Only 7% comes from federal sources. And if you start looking at where these investments go, there's very much. If you invest in food safety, sanitation, environmental health, you're going to reduce enteric disease rates. Next slide, please. What do you find in a successful environmental health department? And I am getting to air. It's coming up real quick here. But if you want to be successful, you better be prevention-based. You better be scientific-based. Provide service to everybody equally. Don't focus on certain areas. Don't focus on certain populations. Make sure you have a balance. We're going to want to regulate you, but we also want to talk. How can we make this program better? How can we help you serve your consumers better? Working with the retail industry, how can you to help them serve the public? But the next point is what is really critical: workforce excellence and development. Within the Air Act, within Indoor Air, within the Clean Air Act, none of this gets done unless the workforce is trained, that they are continually being educated, and that they have the resources they need to enforce, implement, advance these programs. Just because we see the Clean Air Act passed at the federal level doesn't mean it's going to be implemented. In fact, it won't be implemented unless you have the state and local governments and workforce out there trained on this, have knowledge on this, and resources to implement these programs. Otherwise, it does not occur. Next slide, please. This is what we were facing before the Clean Air Act. Air was bad in the US. You really could not function. People had severe asthma. We had blackout dates. We had a situation in Denora, Pennsylvania, where 20 people died, where half the town ended up going to the hospital with respiratory problems because of a smog alert. Mind you, in 1945, nobody even knew what the word smog was. They just knew that sometime the air was bad, and it was just the cost we had to do to have an industrialized society. We've learned from beyond that. We learned that you don't have to live in this conditions, that you don't have to have these kind of air impacts continually in your city, that there are other ways that you can respond. Cars in 1960 were the primary source of air pollutants in Los Angeles. Now it's wildfires. That's where they're getting their problem. Now, in the picture we have on the top there, that's LA, but you can see it is much cleaner, much nicer than it was in 1960. The difference is honestly the Clean Air Act. The Clean Air Act was enacted by Congress. It made a statement saying every state needs to clean up their air. They need to improve the air emissions. They worked with the industry as well. Cars do not pump out anywhere near the pollution that they used to. Now they're almost pollution free. And so this can happen to any city in the world. This could happen to Mexico City. This could happen to Beijing. This could be Mumbai. We don't have to live with bad air. It is our choice to live with bad air. And so we have the technology, we have the standards, we know what to do to clean up the air. Does not mean, though, that we still don't have problems. Next slide. We still are facing climate-related health impacts. We still are suffering through climate change. That's going to occur in the near future, if not in the long future. It is very difficult. How do I want to put it? It's not obvious to integrate climate into environmental health activities. We don't primarily, in this country, in the US, integrate air into environmental health. We're dealing with food, water, and wastewater, not so much the air. However, it has a huge impact. What are we seeing out there? Well, we see particulate matter. We see junk in the air that are coming from industrial sources, from cars, from other things which have to be regulated that can be cleaned up. We're having a problem with ozone that is impacting this country. Nitrogen dioxide, sulfur dioxide, carbon monoxide. We are having situations in this country where kids are getting sick. People are dying from carbon monoxide poisoning. We've had situations where families rent out a condo and the pilot light goes out and they suffocate from carbon monoxide. We've seen this happen in schools. We've seen this happen at pools, indoor pools, where carbon monoxide levels grow so high that they get the folks inside these buildings sick. We're having huge problems with volatile organic compounds. We don't have standards out there, or effective standards, to limit them, and they don't have the regulations out there to address that. Mold, allergens, secondhand smoke, radon. These are all problems that the local environmental health department is having to address without federal support. What I mean by that is, of the entire $6 trillion federal budget, we have $8 million that goes to radon. Not a lot. Mold, we don't have a national federal mold program. We have nothing out there that deals with volatile organic compounds or carbon monoxide. That means it's the locals that have to come up with these standards, that have to come up with these programs. And they do because they have to. It's not because they have a mandate from the federal government. It's because they have to address these problems. Now, I'd be remiss if I didn't answer the most potent pollutant of concern right now, and that's wildfires. Wildfires have really taken off in the past few years. We invest millions in fighting these wildfires, but we invest very little in cleaning up the air in communities after the wildfires have, when the smoke has come into urban areas. These wildfires do come in. The smoke does come into these urban areas. We've seen huge problems in LA. We've seen wildfire smoke from fires in Canada, in Florida. This is not something that the Florida Environmental Health Department of Environment ever had to deal with. They do now. They have to figure out ways to clean the air from these wildfire smokes. That's something that we haven't really been able to figure out yet. And again, we don't have a national program on it. Last thing I'd be remiss if I did not bring out is yesterday the UN came out with the Global Commission on Healthy Indoor Air. That was a program that has been put together. It was initiated yesterday. The UN has an international group of experts that are coming together to talk about healthy indoor air, putting it at the forefront of public health and policy priorities. They are going to establish a global framework for action. This is a well-resourced, well-financed operation, and we can really expect to see a new initiative out there to deal with indoor air environments, which is going to fall on the environmental health community. So at least now we're going to get some direction. Whether we get resources to address it, that's another story. Next slide. In case you'd like to take a quick snapshot of this, this would give you a good resource, a very short comic book we put together about talking about environmental health to your policymakers. This resource is good for any place that has a democracy and has to deal with crazy policymakers because they all have lots of issues on their plates. Trying to raise environmental health is a challenge. And the final slide will say, thank you for hearing me, and I appreciate the opportunity to speak to Environmental Health Australia.
Thank you very much for your time today, Doug. Do we have any questions? I'll open up the questions. What is the biggest policy or regulatory challenges the US is facing right now in ensuring clean air for healthy communities?
Yeah, the biggest challenge, as I said, is wildfires. The wildfire smoke really has impacted communities all across the country. When it comes to autos, which used to be the problem, or stationary sources, we've been able to figure that out. We've been able to get cars to pollute less, but the wildfire smoke, as we know, does not follow boundaries. And so we are suffering from wildfire smoke from the fires in Canada. The fires in Northern California impact Southern California. The fires in the Midwest impact the people in the South. So wildfires are a huge problem.
And the national policy that you mentioned was released yesterday. How do you think NEHA will be involved with that?
With the UN global policy, we are not. There are several American groups that are, including ASHRAE, which is standards and heating, basically HVAC, heating and ventilation and air conditioning. That group has been very involved, and building codes. It's really focused on making buildings healthier. But we are not engaged in that yet. We hope to be.
A question is, for the future of environmental health progress in the USA, are you optimistic or pessimistic?
I am optimistic. I'm abnormally an optimistic person. If I'm not, I would have gotten out of this business a long time ago. You got to be very positive about what we do. But if you look back where we were 30 years ago, we didn't have electric vehicles. We had smog days in many of the cities. We didn't even have Vegemite on the shelves in stores in the US. Now we have Vegemite. So things are getting better all the time.
I think life is a bit better with Vegemite on your face. All right. Well, thank you very much for your time today. And enjoy World Environmental Health Day tomorrow. When you get to celebrate it in the USA, you just have a chance to celebrate a bit earlier with us. Thank you for your time.
Certainly.
Next up, we have our third speaker, which is John Innis. Excuse me. John commenced work at the Tasmanian EPA in 2007 and is currently the air specialist, overseeing air monitoring programs, the assessment of air quality issues for new industrial proposals, and supporting the regulation of industries. Previously, he worked for many years in upper and middle atmosphere physics with the Australian Antarctic Division including 4 visits to Antarctica to conduct the research, and with a year as a visiting scholar at the University of Alaska in Fairbanks. Prior to that, he spent 5 years at the University of Birmingham in the UK as a postdoctoral fellow, having completed a PhD in astrophysics at Monash University soon after the end of the last ice age. Welcome, John.
Thank you very much. I'm hoping my microphone's working. Yes? Okay. Thanks for that. My camera isn't working. Apologies for that, but I'm not very pretty anyway. In contrast, excuse me, to the previous talks, this is perhaps more detailed and hopefully not down a rabbit hole. And I believe I was a late addition, so I'm probably filling in for someone who was much more interesting. Anyway, so the title was Clean Air. Healthy people don't necessarily believe the air quality reading. It could be worse than you think, and I'll explain why. Next slide, thanks, Sam. Thank you. I'm talking to you from Tasmania, Lutruwita, which is the island state of Australia for the people who may be overseas. Very small population, just over 500,000 people now. It is growing slowly. We get about 1.3 million visitors, tourists. We're in the roaring 40s, so a very temperate climate down here. Next slide, thanks, Sam. And just to show you, this was yesterday looking out my window when I got up yesterday morning. We had a bit of snow on Mount Wellington. Thanks, Sam. Next slide. Okay, so this might be a more conventional view. From an air quality perspective, actually Tasmania has a lot in common with a lot of New Zealand, excluding Auckland. I sometimes refer to us as the West Island, a small population, towns in valleys, temperature inversions, and a lot of air quality issues as a consequence. Next slide, thanks. So, we've got a lot of eucalyptus trees, which is a dense, hot burning wood, and of course they're across a lot of the world now. I've seen them in California, I've seen them in England, I've seen them in Spain. I'm not sure I saw any in Alaska, but yeah, New Zealand, across everywhere. Very hot, very good fuel, and we have a lot of forests. A lot of people have access to bush block. They have a friend who's a farmer, or they go out into the national parks and steal the wood. So a lot of people get the wood here at very low cost. So a wood heater, as we call them, or a wood burner, or a wood stove, or a solid fuel stove, combustion stove, they have been very popular in the past. They're probably less popular now. New houses tend to have what we call a heat pump, which is also a term in New Zealand, a reverse cycle air conditioner. We have a lot of hydroelectricity here, so they're actually not a bad choice. We've done some inventories of wood heater use, and generally speaking, the inner city areas of our biggest cities, which still aren't very big by world standards. Hobart's at a pinch 200,000 people if you draw a big circle around us. In the inner areas, perhaps 1 in 5 houses are using them. In a more rural area or the outer suburbs, it might be more 1 in 2 or 2 in 3 houses use them. Sometimes it's the whole street seems to have them. In the past, probably 50 to 60% of houses across the whole of Tasmania were using them. It's probably about half that now, as in over the last decade or two. Thanks, Sam. Next slide. So we do have standards for our heaters about how much smoke they're allowed to produce, and there's the laboratory tests. But in the real world, it doesn't quite work out that way. We still have a lot of very old heaters. They're probably 20 or 30 years old, some of them. Some of them are faulty now. They haven't been maintained properly, and just the operation of the heater makes a huge difference. So we get a lot of smoke. That's just a typical winter's evening in Tasmania. And the next slide as well. Thanks, Sam. That's another view. Actually, it's the same town, a little bit of a valley, a lot of smoke building up there. And by this time of night, usually people are all inside and they don't even notice what they're getting outside. It can be very hard to convince people. We do have wildfire smoke, bushfire smoke, and that's often, when it comes in the daytime, it's really visible and people are aware of it, or the forest industry burns off their residue when we get wood, smoke coming into towns. When it comes in daytime, we'll often get people asking about it, complaining about it, inquiring about it. We can sometimes get as much smoke at night, 10 o'clock at night, but no one complains because no one's outside to notice. Anyway, doesn't say it's any better. Next slide, thanks. We have about 30 plus 34 air stations across Tasmania now, mainly to measure smoke, PM 2.5 as it's called, which is the particle matter below 2.5 microns, 2.5 millionths of a metre in diameter. We're finding in these towns in winter time, and I've just highlighted the winter intervals, which of course is like June, July in the Southern Hemisphere, into August, we're getting a lot of exceedance of our air quality standard. The daily standard for PM 2.5 was 25, it's now 20. So you can see it is quite a problem. Next slide, thanks, Sam. Generally speaking, in the past, we've gone for these, traditional air monitoring stations and traditional air monitoring sites. So you have a hut and fairly expensive equipment as it was then, but the infrastructure, air conditioners and what have you. And they tended to be sited according to what we call our air NEPM, NEPM, National Environmental Protection Measure. It's like NES in New Zealand and US EPA standards and what have you elsewhere. They were meant to be generally representative of air quality in the area. Doesn't stop you doing peak sites as well, but with resources, they tended to be limited to these generally representative stations. If you can see, hopefully that's fairly clear, the air station in Launceston is actually at a wastewater plant, and the suburban areas are sort of surrounding it. There is if you go horizontally to the right from the station into that residential area, that's called Invermay, and that's an old area of Launceston as well. And I mention that because we had a bit of a shock. Next slide, thanks. A number of years ago, we were put a little smoke instrument in a residential address in that Invermay suburb, only about a kilometre away from our reference air station, but the air quality was significantly worse. The blue data, the blue line represents what we measured at this residence, and the red line is our reference air quality station. It was about 3 times. Yeah. It was significantly above at Invermay, so average about 50 compared to about 18 at the reference station, the mean PM 2.5 out of this interval. But every day of full monitoring at Invermay was above the Australian NEPM standard. At that stage, it was 25 microgram per cubic metre. When we looked into it, we were there because the person was complaining about smoke, and basically they were surrounded by wood heaters. No matter which way the wind blew, and almost no matter how hard the wind blew, they were getting smoke coming into their backyard, in effect, into their sort of around their house. Whereas at Tea Tree Bend, when the wind was from the northwest, it was bringing clear air in, and so the station's recording lower. So that was really quite a shock, because clearly that wasn't representative of what was going on in Launceston, which made us wonder, were there other smoke hotspots in Launceston, and of course elsewhere in Tasmania we didn't know about. Next slide, thanks. Sam, and this was all done before a lot of the low-cost sensors came out. So what we did in the winter of 2015 and 2017, we put an instrument in a car with a GPS and a laptop to log it, and we drove around Launceston, did about 20 or 22 nights over the 2 years, about 80,000 individual PM 2.5 measurements. So each coloured dot represents a measurement of PM 2.5 at a location. I'm not sure whether it's possible, and I can't move my mouse, but in the sort of center of the picture, just at the in the middle, slightly down from the top, that says Invermay, and there's a little red dot underneath it. The little red dot is the Tea Tree Bend air station, and it looks like it's in the hotspot, but actually it's not. Our other air station is sort of slightly south, and as in down to the right at up in the hill there at South Launceston, and that we actually realised that our stations were in fairly average areas, but those red areas and the outlying areas in particular, where there are more wood heaters, were really high, really smoky. To the lower sort of right, I guess, there's a place called Norwood. Yeah, Sam, Norwood there. That wasn't a particularly smoky area, but what we actually found, and the next slide, thanks, Sam, we followed up a smoke complaint there, not a very smoky area. The purple symbols, the diamonds, are what we measured in the backyard at Norwood, and that was significantly smokier than our two air stations, which is the red and the blue. So the red and the blue were similar, which is what we're saying was fairly typical, our air stations, South Launceston and Tea Tree Bend. But in this backyard, we were getting very high smoke. And the reason was, next slide, thanks, it was just one air station, one wood heater. Oh, so that inset on the left is the smoke coming off the chimney, and then in the backyard of the house, the smoke was sort of coming round. It was an interesting combination of meteorology, topography, and also a bit of fluid dynamics, and they were really getting fumigated. It was it's a really interesting thing. When we design our standards about how high a flue should be, there's no taking into account the local topography. You know, how you can have a house next door that's the same height as the top of the flue, top of the chimney, and the house below you. Next slide, thanks. And we actually found such things weren't uncommon. These people rang me and said the smoke from our next door chimney, and that the chimney is on top of the house. That little flue, sort of what looks like flue-like thing halfway down, is just the vent for the bathroom. But they rang me in and said the smoke from next door comes down there, rolls down their roof into our driveway, takes a turn, goes down our driveway to the back of the house, turns around the back of the house and comes in our back door. I went up and had a look, and that's exactly what happens. The way the wind works between the houses, this is what was going on. What it means is we know we've done a lot of this work now. There are really localized hotspots that we really don't get a chance to find out unless we can get into people's houses. Next slide, thanks, Sam. Interestingly enough, we know it only takes one very bad wood heater. This is about a month of data from a house also in Launceston. The neighbour with the wood heater also has a caravan, which they park in their front yard, like a mobile trailer home, I guess you call it in the US. And the neighbours knew when the people were away because the caravan was gone, and they logged it. So the blue data was when the neighbours weren't there and the wood heater wasn't operating, and the red is when it was. We actually were in this backyard 3 times, as it turned out, and yeah, this was a common thing. So we know it was just that one wood heater. Next slide, thanks. And this is actually the wood heater, and we have a sort of a visible smoke rule. The top photo and the bottom photo are exactly the same photo, just a little bit of contrast enhancement then to bring up the smoke. And that photo was taken just after I'd spent about half an hour under the plume measuring it, really high levels. I got back in the car and it was like being in a pub in the 1980s or the 1990s, if anyone else is old enough to remember. It was just my hair smelled of smoke, my clothes smelled of smoke. So it definitely was happening. Next slide, thanks. I'm not sure I'm going for time. But as it goes on, and we have other examples. This person said the next door neighbour's chimney, they light it in the afternoon and it smokes me out every time. Next slide, thanks. And so we put a monitor in there. This is just one day, and that high smoke is about 5 o'clock in the afternoon, and that was the plume coming in. This is one of the few cases I actually got into the house to look at the wood heater, just as it turned out, as the EPA is not normally working on domestic. At that domestic level, we're more sort of industrial level, but I got into the house. It was a new wood heater. It was well operated, perfect condition, but the person operating it, sorry, it was well installed and it was a perfectly new wood heater, but the person operating it didn't manage to get the fire going really well, really quickly, so it just smoldered for several hours. And so we just explained how they should do it, and I believe it made a difference. But the person operating it was an 80-year-old single woman, and yeah, it was really interesting to get into the house actually on that case. Next slide, thanks, Sam. I hope I'm still keeping to time. So we've done about 40 or so of these backyard campaigns over the years. They're quite resource intensive, as it turns out, with the deployment and the negotiations, the deployment and the analysis. So we can't do too many in any sort of winters, but we've been doing it for the last decade or so. Majority of cases, we do substantiate that there's a lot of smoke coming in. In the cases where we mightn't say it was at really high levels, there's still some smoke, and it's probably enough to upset the people suffering, but we wouldn't say it was the worst case. We wouldn't know about these places just from our traditional stations. So we do know that people are getting much higher smoke exposures than we would normally think from you looking at your normal air quality data. I do talk to epidemiologists a bit. A lot of the studies in the past have been very much averaged. You just take one station near average, you say the whole town's getting that. I think there is a move now, epidemiologists are realizing that they've got to be more spatially aware, and they're a lot more using land use regressions and things, and I think we'll see more of that. When I say policy officers or planners generally aren't aware of it, it's more that it's information that's just not in their minds as they do that, and as they develop their policies and so on. Next slide, thanks, and nearly finished. And then that's ambient air quality, what actually people are getting inside their house. As Kelsie mentioned, people spend a lot of their time indoors, even in the more temperate climates of Tasmania now, we're more inside. We have worked out what percentage of smoke that's outside gets in. We've measured it a few times. It varies between 0 and 100. In other words, we've got no idea what people are actually getting inside. Thanks, Sam. And the last one. So to sum up, we know in Tasmania there are very, very localised hotspots of poor air because we've measured it, and it's really only 1 or 2 poorly performing wood heaters, or a small number that can be causing the problem, and that gives you very high exposure. Not only is there a health effect, there's also a mental health effect. There's a lot of stress we found with people who are suffering it. Think about when you get stuck behind a car on a highway that's really smoky and you try to close your windows and your vents, you try to get past, that sort of intense feeling you get, I've got to get away from this. When people are in their houses and they can't overtake the house next to them, they live with it. So there is a mental health issue. Rectifying the problem, that's another story, and I'll save that for another time. Thanks very much.
Thanks for your presentation, John. We do have a question. Someone's asked if you could share what the handheld instrument is that you use. So I'm thinking that might be the blanket or the baby blanket.
Oh yeah, that particular one was a US based called a Dylos DC1700, but we had it modified by the manufacturer to be more sensitive to smoke. And we calibrated in a laboratory for smoke. So it's there's a number of them around. The plan towers are reasonable as well. I can put my email in the chat, or put my email in the chat, and we can talk more if people are interested. Yep.
And a question is, from your perspective, John, how can EHOs help balance the community heating needs with the health risks of wood fire smoke?
Yeah, good question. Cold houses, there's health impacts for that as well. So we don't want people in cold houses. You can have the heat without the smoke. I think people just have to be more aware of maintaining their heaters, using them properly, go outside if possible, have a look at the smoke next door. So it's more of an educational thing to say, yes, your smoke's basically unburnt fuel. If you combust it properly, you'll have very little coming out. You can use your wood heater, but just use it properly. Make sure it's in a good condition. So yeah, there's definitely a balance there. Yep.
Lovely. All right. Thank you very much for your time today. And yes, there's no further questions, and we'll move on to our last speaker. Thank you, John. All right. Our last but certainly not least speaker today is Tanya Morrison from New Zealand. Tanya is an environmental health officer, alcohol licensing inspector, and current team leader at Dunedin City Council, where she has worked for over 14 years. Her key areas of interest within environmental health include the tattooing and appearance industries, swimming pool, water quality, and food labelling. Tanya is into her 6th year as the National President of NZIEH, having been the National Vice President previously. And through her role as President, Tanya sits on the International Council of the International Federation of Environmental Health and is part of the Australia-New Zealand Allergen Collaboration Group. Alongside her role with the Institute, Tanya has presented at several conferences around New Zealand, Australia, Malaysia, and America on a variety of environmental health topics. And she's also an honorary teaching fellow at Massey University as part of the Environmental Health Program, lecturing in environmental monitoring and investigative methods, as well as public health law papers. Tanya also guest lectures annually at the Otago Polytechnic for beauty therapist students. Welcome.
Awesome. Thanks, Melissa, and thank you to Environmental Health Australia for having me on today as part of this live chat. Happy World Environmental Health Day to everybody. This year seems to roll around pretty quickly, and it's a pretty exciting theme that we have this year as well to explore with air quality. So what I'd like to just touch upon today in a bit of a brief recap is just a bit of the dust exposure and air quality considerations that came out of a natural disaster, which seem to be getting more and more prominent, as we know, worldwide. But this one in particular was regarding Cyclone Gabrielle, which actually hit New Zealand back a couple of years ago, around February 2023. So with Cyclone Gabrielle, lovely satellite image there. She was a bit of a brutal beast, this one, and affected particularly the Hawke's Bay area, eastern North Island of New Zealand, early 2023. So what we saw with this was high winds, bad flooding, we had loss of power. A national state of emergency was actually declared, and unfortunately 11 lives were lost. Within that, there were many thousands of people who were displaced and their lives absolutely disrupted. And as we know with most natural disasters, the aftermath and the recovery phase is not a quick process, and to this day that recovery continues. Of particular concern and the relevance to this presentation is around the floodwaters, and after they resided, what was left behind in terms of the silt that was created and deposited, which then became, as it dried, airborne as dust. And so this is an example, as mentioned, of when natural disasters and the aftermath they cause can actually now become a public health issue from a dust and other contaminants within the air perspective. So what was actually in the air? And that was the question itself. It's really hard to tell. Obviously, some monitoring had to happen to know for sure, but initially, as you can see from some of the photos here, and particularly the one on the far right, is the amount of dust and dust clouds and dust storms. There were definitely concerns there could be silica in the soil or the silt, as well as some naturally occurring sands that might have come from crystalline silica in the form of quartz. Monitoring did actually confirm that the exposure levels were well below those that might cause silicosis, which is really promising news. But besides that, dust itself causes issues with particulate matter, dust, debris, and other agents that could have been within that dust. So we could be talking heavy metals, other chemical, microbiological contaminants, bacterias, possibly even asbestos as well. It's really hard to tell. So when we think of the main public health risks, not just the exposure to particulate matter, we're also looking at asbestos and silica were two of the main things that were of concern. And due to the quantity of the silt that was actually deposited, as you can imagine, this dust was quite an issue and one that went on for quite some time. So why is that relevant and why do we really care? In terms of dust itself, there's many possible health effects that this can cause. As mentioned, we know of particular concern if we were dealing with silicosis or even asbestos, that in themselves are very big issues to tackle. However, there's also asthma sufferers, anybody with other compromised respiratory symptoms or immunocompromised systems. The airborne dust itself is quite irritating. So you're talking to the eyes, to the nose, to the throat, your respiratory tract. Could also have coughs, throat irritation, sinus irritation and congestion, even skin irritations, depending about how people react to what's in the dust and the air around them. And let's not forget the other thing around actual allergens, such as pollens and coming into the air as well. So it's interesting that sometimes people think they might just have a common cold or a bit of a runny nose or not understand why they're sneezing so much or having a bit of a cough. Whereas in the aftermath of a situation like this as well, it could actually be, little do we realise, because of these dust plumes and clouds that are in the air that are actually affecting us in different ways that typically you may not see to this degree in other, day-to-day walks of life when you're not recovering from this kind of an event. So as part of the response, monitoring, as I mentioned, was undertaken for the air. There was devices deployed all throughout the Hawke's Bay region during September 2023 through to about March 2024, which gave us a wealth of information about the airborne dust and what was actually going on. It was quite reassuring that the overall results in a nutshell basically said the long-term public health impacts following the silt and possible dust exposure were deemed very low, and that there wasn't any asbestos detected in any of the silt samples that were also analysed, which is great as well. A case in point as an example is there was a lot of silt that was generated from the Esk River, and that contaminated much of the land. And in particular, it impacted a school, which was Eskvale School, and the grounds around the school as well. So the Esk River had burst its banks, and that had actually submerged the school in silt. And as the water receded, then the school was also without power, water, internet, but there's all the silt left, which caused this widespread dust, obviously affecting the local environment as well and leading to closures and other health concerns. The school implemented some measures to combat this when obviously trying to get the school back open and operating as best they could for the children. But safety measures they employed included just keeping the students indoors during break times, trying to do monitoring of wind direction and seeking air purifiers within the classrooms as well, trying to really protect the children from dust and what might be in the air. Remembering that the amount of silt takes time to obviously clean up as well, and as it's becoming airborne, they were very conscious and had actually engaged and got their own monitoring as well going within the classroom so that they could keep track of it as well and make sure that their students were not at risk. So in terms of actions and learnings, the first photo there on the left is an example of a great dust cloud. Ways we could try to reduce dust in situations like this is standard practices are trying to spray them down with water, so wetting the dust to try and make it less airborne and remove those dust clouds as much as possible, and also providing some guidance in the wider recovery phase to landowners to try and sow out some fields and grass and that as well to try and reduce down the airborne silt by actually having grass sowed out again. People were also advised to wear masks as in terms of the dusty days or when they were undertaking any kind of cleanup or remediation work on their own properties as well as removing the silt and trying to reduce the dust, as mentioned, by trying to wet it. Multiple monitoring stations were set up. As mentioned, that was privately within workplaces and schools, in the case of Eskvale School, but also just the Environmental Science Research ESR team were also doing multiple monitoring stations throughout the region for several months. So really the take-home message with this is an example in a very brief whirlwind amount of time that, as we know, natural disasters and events like this have a devastating impact on so many walks of life, not just our health, our livelihoods, the huge disruption, the financial and other costs that go with what these events incur, and the recovery goes on for years and years and years. And we know worldwide that there's also an increase in natural disasters and things like this happening, whether it's a cyclone, whether it's bushfires that we've heard about earlier today as well. It's a great example to celebrate World Environmental Health Day to highlight some of the work that we do in environment and public health in the wider space. And just considering that we are here as the frontline soldiers more often than not, trying to obviously protect and promote people's health and their livelihoods as much as we can. So it's about how we prepare for these situations and how we respond, how we can educate and advise and do our best to obviously protect everybody as much as we can. So finally, just a huge shout out on behalf of the New Zealand Institute of Environmental Health. We would like to acknowledge and thank environmental health officers worldwide for everything that you do. It's an amazing profession. That's why we're all in it. It's a silent profession. It needs a little bit more of a voice globally to make sure that we acknowledge the great work that we're doing. Basically, we worry so you don't have to. So a huge thank you from us, and I'm happy to take any questions at all.
Thank you very much for your presentation, Tanya. I do have a question. Do you have any data or information or heard any cases about the children at the school and if they had any health impacts, or was it all mitigated by the preventative public health measures that were in place?
I haven't got any data to hand on that. I'm not sure if that was specifically dived into or not. I mean, this is an example of, a private place, I was going to say workplace, but school environment that also were being proactive to really appreciate the vulnerability of children and what the natural environment was throwing up as a risk. So they took those active steps of monitoring air purifiers and trying to protect their kids whilst trying to get back to business as soon as they could as the cleanup was going on. So I don't have any data about what the effects were, But it is an example of a proactive step and trying to protect health as opposed to respond to health consequences or effects after the horse has bolted, essentially.
Yep, excellent. And what lessons from Cyclone Gabrielle could help EHOs elsewhere prepare for environmental health impacts of extreme weather events?
Yeah, it's an awesome question. I think we'd spend a lot of time in environmental health profession thinking about risk management, disaster risk management. So there's a lot of plans in place that when situations like this unfold, it's about how we kick in and respond as quick as possible. So not just through our monitoring and our mitigation, but recognising quickly what the risks are and trying to mitigate them as quick as possible. So I think what we can learn from this is how we can just strengthen our response plans to actually react as soon as possible so that we're not having dust with nobody knows what's in it going around for days, weeks on ends, when we know we could be covering it, removing it, wetting it, putting these other preventative measures in place very quickly. It just helps us respond.
Yep, and also very relevant to this year's International Disaster Risk Reduction Day, which is fund prevention, not response.
Absolutely.
Yep. Thank you very much for your time today and your presentation. And I would like to also thank everyone else who's joined us today for this inspiring and insightful World Environmental Health Day live chat. It has been an honour to host this global conversation and to shine a light on the critical work being done by environmental health professionals around the world. I'd like to extend my deepest thanks to our guest speakers, Kelsie Dale, Doug Farquhar, Tanya Morrison and John Innis, and for generously sharing their expertise, experiences and perspectives. And each of you have brought unique insights to the table and helping us better understand the complex challenges we face in the vital role we all play in ensuring clean air and healthy communities. So you see, this year's theme, Clean Air, Healthy People, is more than a slogan, it is a call to action. And we've heard today how far-reaching the impacts of air pollution are, not only on human health, but our economies, our ecosystems, and the well-being of future generations and our vulnerable populations. We've also seen how environmental health professionals are at the forefront of addressing these challenges, identifying risks, shaping policy, educating our communities and driving practical solutions. So on behalf of the Environmental Health Australia, thank you again for being part of today's celebrations, and stay connected, stay inspired, and let's keep leading the way, because where health protection begins, environmental health professionals are already there. So happy World Environmental Health Day 2025, everyone. Thank you.